All right, today we're jumping into a topic that's, absolutely central to our lives, but one we don't always talk about openly, reproductive health. And it's so much more than just biology. It's about our choices, our futures, and our overall well-being. So let's get right into it.
So let's kick things off with a pretty fundamental question. What does it actually mean to be healthy? Your mind probably goes to things like diet, hitting the gym, or not catching a cold. But true health, especially when we're talking about reproduction, is a much, much bigger picture.
Okay, so check out this definition from the World Health Organization. It's not just about your body working correctly. It's about total well-being, physical, emotional, even social. This is a huge shift, right? It means a genuinely healthy society isn't just one where people are free from disease, but one where they can have positive, respectful relationships.
Now, let's zoom out a bit. We've talked about the individual, but let's look at the whole of society. Because our individual reproductive health, when you add it all up, has this massive collective impact. And that really comes into focus when we start talking about population.
I mean, just look at the speed of this change. It's wild. For most of human history, population growth was pretty slow. But in the last century, wow. As health facilities got better and living conditions improved, the world population just skyrocketed from 2 billion to over 7 billion. That's a truly explosive change in a very short time. And to see this on a national scale, look at India. By 2011, the population there crossed 1.2 billion people. Now, that kind of rapid growth puts a huge amount of pressure on basic resources. And it's exactly why governments, like India's, started creating national family planning programs way back in 1951.
So you've got this huge puzzle, right? How do you manage this enormous societal challenge of population growth, but at the same time empower people to make their own personal choices? Well, the answer that really came to the forefront was contraception. It's this incredible tool that allows for both big picture planning and individual freedom. So let's start with the most basic category, natural methods. The idea here is pretty simple. It's all about avoiding the chances of sperm and ovum meeting, whether that's timing things around the fertile window, withdrawal, or relying on the body's natural infertility during intense breastfeeding. The big plus, you're not really going to see side effects. The trade-off, though, is that because they depend so much on perfect timing and behavior, the chances of failure are, well, a lot higher. You can really group all contraceptives into two main philosophies. On one hand, you have methods that create a physical barrier, think condoms, or use natural timing. On the other hand, you've got hormonal and surgical methods that actually work with the body's systems to prevent things like ovulation. And as a general rule, the more a method intervenes with the body's cycle, the more effective it tends to be. And in a country like India, while there are a ton of options out there, three categories have really become some of the most widely accepted and practiced: IUDs, oral contraceptive pills, and permanent surgical methods. This chart gives us a really good side-by-side comparison. You've got IUDs like the copper T, which are placed in the uterus and basically make it an unfriendly environment for sperm. Then there are pills like the Indian-developed Saheli that work by stopping ovulation and implantation. The key thing about both of those, they're reversible. And then you have surgical sterilization, a vasectomy for men or tubectomy for women, which physically blocks the path for sperm or eggs. Super effective, but the big thing to consider is that it's designed to be permanent. So, contraception is all about preventing pregnancy. But what happens when prevention doesn't work, or in other really difficult situations? Well, that brings us to the very complex and sensitive topic of medical termination of pregnancy, often known as MTP. Now, the definition itself is straightforward. It's the voluntary ending of a pregnancy, but the issues surrounding it are anything but simple. The government of India made MTP legal way back in 1971, but they did it with some very strict conditions to prevent misuse. And of course, this remains a deeply debated topic all over the world because it touches on some really profound ethical and social questions. And just to get a sense of the scale of this, think about this number. Somewhere around 45 to 50 million MTPs are performed across the globe every single year. That works out to about 1/5 of all pregnancies. So it's a significant and often unspoken part of reproductive health worldwide. So what are those strict conditions for legal MTP in India? The law is very specific. It's permitted in cases where continuing the pregnancy would risk the mother's life or cause serious harm to her physical or mental health. It's also an option if there is a high risk the child would have severe abnormalities or in traumatic cases like rape or even contraceptive failure.
All right, we've talked a lot about choices around pregnancy. Let's shift gears to another vital piece of reproductive health, protecting ourselves from disease. Sexually transmitted infections, or STIs, are a major threat to a healthy society. But the really good news here is that they are largely preventable. Okay, this is a really crucial point. While anyone can be at risk, STIs are reported to be most common among young people, specifically in the 15 to 24 age group. And that just makes it absolutely essential that clear, direct information gets to them, so they're empowered to make safe choices. So the big, obvious, and most important question is, what can you actually do? How do you stay safe? Well, thankfully, the strategy is pretty straightforward. Really, the path to prevention comes down to three simple but powerful rules. First, be mindful of your partners. Second, always use condoms. They are an incredibly effective barrier. And third, and this is so important, if you have any doubt at all, don't just wait and worry. Go see a qualified doctor. Getting checked out early is not just key for your own treatment, it's also critical to stop an infection from spreading to others. Okay, so we've covered preventing pregnancy and preventing disease. But a full discussion on reproductive health has to include the challenge that so many couples face, infertility, which is the inability to have children even after trying. And this is an area where modern science has stepped in with some absolutely incredible new options. The umbrella term for all these amazing techniques is ART, which stands for Assisted Reproductive Technologies. Now, the most famous of these is definitely IVF, or in vitro fertilization. You've probably heard it called the test tube baby program. Essentially, eggs are taken from the mother and sperm from the father, and they're combined outside the body in a lab. Once an embryo develops, it's carefully transferred back into the uterus to hopefully grow into a baby. It's a pretty amazing process. But IVF is just one of many tools in the ART toolkit. There are other highly specialized procedures like ZIFT, which is transferring an early embryo into the fallopian tube, or GIFT, where the egg and sperm are placed there to fertilize inside the body. There's even ICSI, where a single sperm is injected directly into an egg. The bottom line is, science now offers so many different pathways to becoming a parent. But with all this incredible high-tech science, it's so important to remember another powerful and wonderful option. As our source material points out, legal adoption is permitted, and for many, it remains one of the very best ways for couples to become parents. It's a choice that's really rooted in love and providing care for a child who's already here in the world. And really, that brings us to our final thought. From contraception to IVF to adoption, science and society have given us more choices about our reproductive lives than any other time in history. So the big question for all of us to think about is this. As these choices keep expanding, what does the future of family really look like? Thanks for joining us.